Hi, my name is Dr. Bijan Salari, and my colleagues and I have recently published our video article entitled The Hysteroscopic Morcellator to Overcome Cervical Stenosis. Uterine perforation is one of the leading complications of hysteroscopy and more often occurs when trying to overcome cervical stenosis. Blind mechanical dilation is the historical approach, but can lead to false passages in addition to uterine perforation. Medical management, including cytotech and surgical approaches, have expanded over the years in order to safely overcome the challenging cervix. The advancement of the surgical management reported in the literature for cervical stenosis includes forceps, scissors, bipolar electrodes, the resectoscope, CO2 laser vaporization, and the VersaPoint electrode, where cruciate incisions are made or resection of endocervical tissue is performed. Recently, gynecological surgeons have increasingly utilized the morcellating blade, which is currently used for the intrauterine resection of polyps, fibroids, and the removal of retained products of conception. In our video, we present a novel approach of using the hysteroscopic morcellator to surgically and safely enter the uterine cavity in the case of severe cervical stenosis. We have presented two techniques. One that demonstrates the use of the morcellating blade directly at the site of stenosis, and another that shows the use of a guidance catheter and ultrasound guidance as a means of directing the hysteroscopic morcellating blade in the case of more extensive cervical stenosis. Here we resect enough tissue, allowing us under direct visualization to advance the hysteroscope. To date, in the more than 30 cases we have performed, we've had no complications with this procedure. Further studies should pay particular attention to complication rates, including cervical restenosis, uterine perforation, hemorrhage, and cervical incompetence. We believe this technique to be another alternative to the current medical and surgical management for cervical stenosis. We hope you take the time to view the video article. Thank you very much for your attention.